Hi, everybody. Welcome to week 3. We have a lot to go over this week. We really have a meaty topic. As I looked over the lecture for this week, and the lecture is provided by Grand Canyon University, as I looked over it for this week, we're talking about needs assessment for curriculum development. I've been involved in several clinical startups, and then I've also taught for some quite new colleges and universities. And it's very interesting. When you very first are looking at a startup, of course, you've got to start with the question, is there really a need at all? And I think in nursing education, obviously we're facing a shortage, but I think in some areas we see a lot of for-profit ADN programs starting up that maybe there isn't quite the need in their community, or there aren't enough resources, and we'll be talking a little bit more about that. So lots to consider when we're doing a needs assessment. So we've got two discussion questions this week. The first one is, who are the stakeholders in curriculum development? And then the second one talks about community of interest when looking at a new nursing program. It is amazing how many stakeholders there are in nursing education, starting from the accrediting bodies to clinical arena, gen ed educators. Oh my gosh, there are so many. So I look forward to reading your posts, and then I'll probably be adding some more based on the experiences that I've had with startups and working with newer entities. One thing I did want to share with you, since we're talking about curriculum development, I do want to talk to you a little bit. When I was teaching on ground, I would teach classes like Foundations, MedSurg 1, MedSurg 2, Leadership, different things like that. And I want to talk to you a little bit about how the process of actually I put together a class period. So I start off with what are my objectives for that class period. Hopefully they're already in the syllabus. If not, I need to take the global objectives for the course, and then I need to narrow down my objectives for that particular class period. I also need to know where my course fits in with the curriculum, what have the students had that I can hopefully count on them having knowledge from, and what am I preparing them for the next course in the curriculum. So I kind of need to see where I fit in. For instance, in my MedSurg 2, I would often teach about respiratory. Respiratory is one of the areas that I love. So taking care of acutely ill respiratory patients. And I had to look back through the other courses to see what their baseline knowledge was, and then to look ahead. So, okay, figure out your objectives. And then I needed to do all the readings that I was expecting my students to do, so I would know exactly what they were preparing for, hopefully before class. So I did those readings, and then I would get out other textbooks dealing with that advanced med-surg and look at care of the acutely ill respiratory patient and their sections. And then if there were specific disease processes that I was going to look at, then I would also look online for like American Lung Association, different things like that, to see what's the latest research, what are we doing with clinical trials, is there anything new going on in the field. So all of that was kind of my prep work. Once I figured out, then did my prep work, had my objectives, then I had to figure out what is the best way for the students to gain this knowledge. Not what's the best way for me to teach it, what's the best way for the students to gain the knowledge. For some topics, a lecture that's very interactive back and forth is the best way. For other topics, maybe hands-on is the best way. Maybe I needed to set up some stations and allow them to go through some different scenarios. One thing that I really love doing is presenting an unfolding case study. For instance, I might have a patient who starts in the ER, and that's our first little vignette, and we talk about what we know and what we don't and how we would care for that patient. And then I might move them to med-surg, maybe the ICU, maybe to home care or a skilled nursing facility. So as their status changes, what are the different priorities? What are the nursing diagnoses that are appropriate? So just very much engaging the students, those active learning strategies. Sometimes games are helpful, especially maybe if you're doing some review before a test, or maybe you're trying to determine your students' existing knowledge and where you maybe need to start your class period. So, oh my gosh, all different active learning strategies. But basically, I would look at my time and try to identify how best the student could learn the information and then craft my time period between more kind of traditional teaching but still very interactive, or skill station, or collaborative learning, group work, and kind of mix that up until I came up with a total plan to meet those objectives in the ways that I thought the student would learn them best. So it takes a ton more time to prepare for a class than to actually teach a class. You just need to know that up front. All right, so we're going to be talking a lot about needs assessment for curriculum development, and I think we'll have some really good discussions. There's some documents that I might throw your way. Your reading wasn't bad for this week, so I might post a few articles. Your papers that you submitted, very excited, everybody got those in, and I'm going to gradually be looking at those today and tomorrow again. I'm actually attending a pediatric conference, and so I just have a little bit of time at night, and then I'm going to hit them hard on the weekend. So at the very latest, the papers will be graded Monday night. So you can look forward to that. Oh, I need to warn you. These are the first papers that you're turning into me. You're going to see a lot of red on them. I will apologize up front, but I'm trying to give you a lot of feedback so that you can continue to improve. I will give you feedback on grammar and APA and all that good stuff. MSN prepared nurses are expected to be professional writers, and so it is the only way that you can learn is submitting, getting feedback, looking at what you did, and trying to make improvements for the next time. It would be great if all of you were already wonderful writers. That would be wonderful and save me a lot of time, but expect to have a lot of feedback on your papers. Okay, so I think that is about it, and I'm looking forward to hearing your thoughts about this week's topic. See you in the main forum.